Consider the non-exposed persons. Yellow bar. Although they are not exposed, they have some risk of the disease. But the risk of unexposed person is at a much lower level than that of the exposed persons. That is, the risk of a disease is not zero for the unexposed persons. This risk is termed background risk. Every person shares the background risk regardless of whether or not he/she has the specific exposure in question. Therefore, the total risk of a disease in exposed individuals is the sum of the background risk that any person has and the additional risk due to the exposure in question. If we want to know how much of the total risk in exposed persons is due to exposure, we should subtract the background risk from the total risk. Because the risk in the unexposed group is equal to the background risk, we can calculate the risk in the exposed by subtracting the risk in the unexposed group or the background risk from the total risk in the exposed group. Thus, the incidence of disease that is attributable to the exposure in the exposed group can be calculated as follows. We could instead ask, what proportion of the risk in exposed persons is due to the exposure? We could then express the attributable risk as the proportion of total incidence in the exposed group that is attributable to the exposure by simply dividing the formula of the attributable risk by the incidence in the exposed group as follows.